with a high rate of success is diagnosed in an early phase, and screening is essential in ensuring that women have early access to therapy. Now I'm going to introduce our guest, our participant to this webinar. The first is Sonja Fürnsinn, Head of International Relations of PremiQaMed Privatkliniken from Austria, the leading private hospital in Austria. Professor Christian Kainz, Medical Director of Privatklinik Döbling, one of the clinic of PremiQaMed. And Patricia Davidescu is a manager for international patients at PremiQaMed. And she will also ensure the translation in Romanian of this webinar. So first, Sonja Fürnsinn will present us a few words about PremiQaMed, but just first we'll show you a video about how patients are treated to the clinics of PremiQaMed.
Die Privatklinik Döbling hat einen Schwerpunkt zum Thema Frauengesundheit. Sie bietet gemeinsam mit dem Ambulatorium Döbling ein sehr umfassendes Angebot für Frauen, beginnend von frühester Jugend, Kinderwunsch, Geburtshilfe, Pränataldiagnostik bis ins höhere Lebensalter alle Leistungen und Behandlungen an. Mit Vorsorge kann man Erkrankungen verhindern oder in einem sehr frühen Stadium erkennen, zum Beispiel im Rahmen der Brustgesundheit, ein Screening auf Brustkrebserkrankungen. Hier haben wir modernste Geräte und Methoden von der Magnetresonanztomographie bis zum Ultraschall und der Mammographie zur Verfügung. Wenn sich eine Operation nicht vermeiden lässt, sind Frauen bei uns im Haus besonders gut aufgehoben, weil wir minimalinvasive Methoden anwenden und mit diesen Methoden gibt es kleine Narben, eine kurze Nacherholungszeit und beste Ergebnisse. Die Geburtshilfe der Privatklinik Döbling bietet für die Frauen und für die Familien eine durchgehende individuelle Betreuung während Schwangerschaft und auch während der Geburt und während des Wochenbetts an. Schwangere Frauen können bei uns individuell entbinden. Sie können, wenn sie wollen, einen Wunschkaiserschnitt bei uns durchführen lassen oder wenn sie natürlich entbinden wollen, stellen wir Hebammen zur Verfügung, wo wir dann eine ganz niedrige Kaiserschnittrate nur erreichen, falls das von der Frau gewünscht wird.
Fetomed ist ein Zentrum für Fetalmedizin hier in der Privatklinik Döbling. Unser wichtigstes Ziel ist, allen Schwangeren Zugang zu modernster Pränataldiagnostik zu ermöglichen. Die Schwangeren erhalten bei uns nach der Untersuchung immer sofort einen Befund, eine Beratung zu den Befunden und nach der Ultraschalluntersuchung werden auch 3D-Bilder gemacht. Sie kriegen die online zur Verfügung gestellt, damit Sie zu Hause noch einmal die Bilder anschauen können, die Videoclips von den Kindern anschauen können. Einerseits geht es um die Technik auf höchstem Niveau und andererseits geht es auch darum, die Freude an der Schwangerschaft noch zu verstärken durch schöne Bilder.
Wir sind hier eingebettet in der Privatklinik Döbling mit unserem Kinderwunschzentrum und bieten die komplette Diagnostik, die in unserem Bereich zur Verfügung steht, an. In weiterer Folge geht man dann über in die Therapiemöglichkeiten. Auf allen Therapieebenen sind wir so aufgestellt, dass wir beginnen von der Insemination auch die künstliche Befruchtung durchführen können, inklusive der ICSI-Therapie, das heißt der Injektion der Samenzelle in die Eizelle. Ebenso ist es bei uns so, dass wir das Samenspendeprogramm anbieten können, beziehungsweise erlaubt es uns auch der Gesetzgeber, eine Eizellspende in Österreich durchzuführen. Wir bieten natürlich auch eine sehr hohe Erfolgschance unseren Paaren. Auf höchstem akademischen Niveau versuchen wir nach dem letzten Stand der Technik bzw. der Wissenschaft die Therapien durchzuführen und die Möglichkeiten einfließen zu lassen.
We'll back to the webinar with the subject Women's Health Matters. And now with our participants, we'll show you why this subject is so important. First, our first participant is Sonja Fürnsinn, Head of International Relations of PremiQaMed. Sonja, PremiQaMed is the leading private hospitals operator in Austria. I know that you prepared a presentation about the activity of your company and why women's health matters very much, especially into your clinics. So Sonja.
Good afternoon, dear participants of this webinar. My name is Sonja Fürnsinn. I represent PremiQaMed, and we are very pleased about the opportunity to give you a little bit of information about treatment at Privatklinik Döbling. Women's health is the topic of today, and Professor Kainz will give you a lot of information and reply to your questions. And I want to give you a short introduction about PremiQaMed. PremiQaMed is the largest provider of private medicine in Austria, offering a lot of services on an inpatient, outpatient day clinic basis, as well as rehabilitation. The group has been successfully growing since 1991, and it offers treatment in 5 private hospitals and 1 rehabilitation center with a total of 800 beds. And Döbling Private Hospital, which we talk of today, is the largest private hospital in Vienna. Why delay of treatment is not an option? COVID-19 has been the #1 topic over the last 8 months, but unfortunately a lot of other medical problems have been neglected during this time. So treatment of chronic diseases has been interrupted, a lot of operations postponed or even cancelled. In many cases of suspected cancer, important examinations have not been made, as well as health prevention programs for the early detection of diseases. So many patients think that the risk of catching COVID-19 is higher than delaying necessary treatments, but this is often not the case. Of course, we see dashboards of COVID-19 infections every day, but there are no dashboards showing how many lives have been lost due to delayed treatments. And doctors are very concerned about this and call upon patients not to delay further necessary treatments or examination programs. At the Döbling private hospitals, Austrian and international patients are admitted under the strictest security rules. The hospital offers a wide range of services on an inpatient and outpatient level. And the main topics include women's health, about which we will talk today, oncologic diseases for adult patients, surgery in various fields, treatment of gastrointestinal diseases, preventive health programs, as well as orthopedics and traumatology. And now we will move on to today's topic of women's health. Thank you.
Thank you very much, Sonja. I will introduce you the next participant. It's Professor Christian Kainz, Medical Director of Döbling Private Hospital. He's a very well-known specialist, especially in gynecology and obstetrics and in oncologic gynecology. So it's a very well-known specialist in Austria, but also in Europe. The first question for you, Professor Kainz, is that you have been medical director of Döbling Private Hospital for so many years. And how has the hospital developed since you took this position?
Hello, I'm happy to be with you today. As you said, I am the medical director since 2001. And since that time, the hospital has evolved in many ways. On one hand, it has expanded in space. Today, it's the largest private hospital in Vienna. And on the other hand, it also has expanded to include many facilities and specialist areas. Today, the clinic offers a very wide range of medical services at various levels. And we have a very good development during that time.
I know that a slogan of the Döbling private hospital is everything under one roof. What does it mean for your patients?
It means that we want to offer the patient the maximum of medical service in one house. That means under one roof, not only the inpatient treatment, but also the outpatient examinations and treatments in our outpatient clinic and in our doctor centers, as well as physical medicine and rehabilitation. That means that from simple consultation, for example, at the doctor centers, high-tech diagnostics, comprehensive preventive programs, and also complex surgical procedures with post-operative rehabilitation and physiotherapy can receive the patient in one house in our hospital and outpatient clinic.
What do you think, Professor, that it is crucial for a successful treatment?
The basis is the excellent medical infrastructure, but of course it's also very important the doctors who make the success and all the medical staff at our hospital. Our hospital works with top-level specialists in the medical field. Many of them are involved in renowned research projects. Part of them are working at the university clinic also and have an international experience. The specialists of different disciplines work in a close cooperation, each together. This is one of the big success in modern medicine. And this good cooperation between the disciplines is becoming more and more important.
How would you describe the procedure when a Romanian patient asks for a problem in the Döbling private hospital?
In most cases, inquiries are received by email, either directly to the clinic or to our international desk, which is the service department of the hospital for international patients, and in which also Romanian-speaking staff is at work and processes inquiries from the international patients. Based on the medical findings, we receive a suitable specialist is selected who can take over the case and take over the lead for these patients. This doctor analyzes the case and makes a treatment proposal based on which a cost estimate is prepared. This is usually within 2 days possible. There are no long waiting times for treatments or for surgery, and we have a very flexible organization, so you can get appointments for treatment and surgery right in time.
Professor, your clinic, Döbling private hospital, is very well known for women's health and offers top-level care for all medical issues in a woman's life. What are the areas?
Obstetrics, and obstetrics starts also with in vitro fertilization in many cases. So we have a special department for assisted reproductive medicine, which makes state-of-the-art treatment methods in the safe setting of a clinic, discreet and in an upscale atmosphere with a high pregnancy success rate. Prevention for women and early detection of different diseases, gynecology and gynecologic surgery with modern gentle surgical methods and minimal invasive surgery. And last but not least, breast health, here from early detection with new treatment methods for breast cancer, minimal invasive and safe at the same time.
Because you just have spoke about obstetrics. I know the obstetrics department of Döbling private hospital was voted the best obstetrics department in the country. What makes it stand out?
Yes, our obstetrics department has been voted the best in the country in an independent research. Our aim is to offer women as much freedom as possible with a maximum of safety and security. Together with the woman, it is decided how she wants to give birth to her child into the world. We try a very individualized approach and to fulfill her personal wishes as much as possible. If a woman wants a natural birth, she has excellent midwives, which are the basis for such an approach. But it is also possible to have a cesarean section. The father of the child, of course, is welcome to be present at the event, also with this cesarean section. And in doing so, we offer the young families an atmosphere in which they can feel safe and comfortable. Nowadays, due to the pandemic, strict safety rules, which are now applied in the obstetrics department, we have a very safe environment, but the fathers are allowed to attend the birth and stay with the mother and the child in a family room, also nowadays.
We now pass to another subject, very important subject in medicine, preventive medicine. It's very important also for Döbling Private Hospital. So what is your recommendation for our audience?
So prevention is very, very important because it avoids disease and illness. Prevention starts, of course, with a healthy lifestyle, and it is supplemented by regular preventive examinations. In the investigations, it's important to select the right studies in order to really generate benefits and avoid damage. This is ensured by our high quality program and our modern equipment. On the other hand, there are ready-made preventive modules which you can book, which have been created on the basis of the current medical knowledge and are state-of-the-art, with individual examination programs that can also be created for certain medical issues and based on the individual situation of the patient.
Because our main subject here is women's health, what should be the preventive measures for women?
For women, in addition to an accurate anamnesis survey to have an individual risk profile and a clinical examination, a vaginal ultrasound, a pap smear, and a hormone test should be made. In addition, we recommend testing for the human papillomavirus if necessary, and papillomavirus vaccination if necessary. From the age of 40 or 45, the breast should be examined by mammography and ultrasound.
Because you just spoke about breast cancer, I know that this is an issue that scares many women today. However, great progress have been made in the treatment during the last couple of decades. What has made this possible?
In recent years, new methods and new drugs have been established and become established in the field of treatment of breast cancer. In addition to the central objective of oncological safety, the preservation of the breast and a good cosmetic result is important, and also the reduction of side effects are also a central concern today. However, the success of the treatment also has to do with the fact that specialists from different disciplines work closely together and jointly develop treatment plan individually for each patient. This is done in a so-called tumor board, which is a very important tool in a safe and individualized treatment, individualized personal medicine. Because there is no longer any standardized therapy for all patients. In all decisions about diagnostic and therapeutic measures, special attention is paid to the individual factors of the patient and of the biological patterns of the tumor. This is the so-called individualized medicine, which I have talked about. For the right therapy decision, biomarkers and various tests provide the important information about the condition and the aggressiveness of the tumor. The goal is to use the most effective treatment with the least possible side effects.
Professor, in most cases, surgery is still part of the therapy, but nowadays, in many cases, removal of the breasts is no longer necessary. Can you tell us a little bit about this subject?
You're right. Nowadays, in most cases, this is no longer necessary. This is due to the improved surgical and therapeutic procedures. Of course, also the early detection is an important step in this direction. But large tumors can sometimes be reduced by chemotherapy or immune therapy or anti-hormonal therapy to achieve a shrinkage before the surgery and to achieve a very good surgical result. In breast preserving surgery, if the breast preserving surgery is not possible due to the size or the nature of the tumor, for example, in multifocal tumors, breast reconstruction is performed by an experienced plastic surgeon in the same operation. That means the surgical treatment is at the same time also a plastic surgery. Early detection of carcinoma is always crucial for the successful treatment. And for this purpose, we have at our disposal very advanced state-of-the-art devices for mammography, tomosynthesis, ultrasound, and magnetic resonance imaging.
Because your hospital is specialized in obstetrics gynecology, how has gynecological surgery developed?
Gynecological surgery is less radical today. In the last 10 to 20 years, for example, the number of uterine removals of hysterectomies in our countries have halved. So it is only necessary to, in about 50 or less % of cases, and other minimal invasive treatments are available today. And depending on the type of disease, total removal is not always required. Sometimes there's the possibility to remove only the part about the cervix or a fibroid in the uterus and to preserve the cervix. In some cases, this is also possible to choose a gentle operation access. Open surgery with abdominal incision is usually only required for malignant disease. In the case of benign diseases, the uterus can sometimes be removed by the vaginal route, or this method is called the vaginal hysterectomy. This is the method that shows the least postoperative after effect. There is also the possibility of the uterus to be removed laparoscopically. That means by a minimal invasive approach, where the camera is introduced and the instruments are introduced in the abdominal cavity through small incisions. This method is also much gentler for the patient compared to the abdominal incision.
Professor, I know that your hospital has already treated a lot of international patients, including patients from Romania. Is there an example of a patient from Romania that you have been particularly reminded of?
Yes, I remember a young patient who should have the uterus removed because of a carcinoma of the cervix. And after extensive testing and careful testing, we were able to cure the patient with minimal invasive surgery, and she was able to continue to have children. Her childbearing was still possible.
Another subject I would like to talk about is the current pandemic situation, because we are in terrible times of a very large COVID-19 pandemic. What is the current situation in Austria with regard to COVID-19?
As in most European countries, the number of infections increased again at the beginning of the autumn. In Austria, this also is due to the fact that many more tests are now being carried out at the moment. This means that many more asymptomatic cases are recorded. But in general, the situation is very well under control, and there is sufficient hospital capacity, and all COVID-19 cases are dealt with are all dealt in separated units in the public hospitals. If a patient, for example, from Romania wants to come to Vienna, there are exceptions for patients who need a treatment in Austria. This requires confirmation from the attending physicians and the clinic, and we are happy to provide this. And we are testing all patients before they're admitted, and so also patients from abroad need a negative PCR test before they are treated in our hospital, so it's very safe.
Professor, preventing the spread of the new coronavirus in hospitals, it's a very hot issue here in Romania. What security measures are taken at the Döbling private hospital to prevent the spread of the virus?
We have a very strict safety concept to prevent on one side the patients and also the clinical staff at our hospital. All Austrian and international patients must take a PCR test before admission in the clinic, and positively tested patients are not admitted in our private clinic. The access to the clinic is only possible via marked checkpoints. Hand disinfection is monitored by trained personnel, and all people who want to enter the clinic are diagnosed with fever and have to complete a questionnaire diagnosed with fever measurements. Patients and visitors must wear mouth, nose protection in all areas of the clinic. So with this safety concept, we are I think we are on this very safe side.
We know that Döbling private hospital is specialized in women's health, but apart from women's health, which other disciplines are particularly worth mentioning in the Döbling private hospital?
Oncology is one of our main fields. We treat many cases of stomach or colon cancer, for example, cancers of the female organs, breast cancer, prostate cancer, lung cancer. In orthopedics, we have mainly cases of spinal surgery, foot and hand surgery, joint surgery. As a special topic, I would like to mention our osteomyelitis treatment. That is the surgical treatment of bone marrow inflammation, which can last in some patients for a very long time and make them suffer from this condition. With conventional methods, treatment is often very lengthy. At our hospital, at the Döbling private hospital, a unique method is used, which in most cases allows a cure such patients by a single operation. Another main field is traumatology. We have several specialists in our hospital who are also team doctors of national sport teams. Their experience in professional sports also benefits other patients. From the comprehensive diagnostics with our modern technology, state-of-the-art surgical methods, to post-operative rehabilitation and physiotherapy, our clinic offers everything to achieve an optimal treatment outcome and enable the patient to return to an active life very quickly. We also treat many urological cases, most notable disease of prostate. For example, prostate cancer is one of the most common oncological diseases in men, but now it can be treated very successfully with an early detection. It is important to have an exact diagnosis And here too, we are using a new procedure, the so-called prostate fusion biopsy, where the magnetic resonance imaging image is fused with the ultrasound, and there is a computer-targeted biopsy in the right area of the prostate where the suspect lesion is.
Professor, because you just told us about all these disciplines, what are the main medical problems for which patients from Romania address Döbling Private Hospital?
Patients from Romania address us primarily with diagnostic questions, oncological, gynecological, orthopedic, and surgical topics. So there is a wide range, but these are the main fields. There are also requests for a second opinion. That means people want to have their diagnosis checked again by one of our specialists. And we offer these in various areas. For cancer cases, for example, patients can have their diagnosis checked by an experienced team of specialists and also receive an individual therapy proposal, which has been also discussed in our tumor board. The second opinion can be made on site in the clinic as well as at distance via teleconsultation.
Because we are in a very competitive area, healthcare, what do you think distinguishes the service of the hospital compared to other private hospitals or public hospitals?
So one of our strengths is the high level of service orientation and flexible organization, the so-called one-stop shop principle. That means you get everything in short time in one house. That means the patient receives all the necessary services under one roof in the shortest possible time with short waiting times, but also the very good interdisciplinary cooperation of the specialists I have mentioned, as well as the individual care as in personalized medicine. Patients are continuously cared by one specialist who takes care of them. This means that this doctor is the patient's contact person throughout the treatment process. He also organizes all other required specialists and procedures. And it's also important to us that there is a relation of trust and mutual respect between the doctors and the patients. And together they discuss all diagnostic and treatment steps and make all decisions together. This not only creates trust between them, it also encourages the patient to take a more active role in their recovery and be part of their recovery.
Professor, in your hospital, you're talking a lot about the concept of healing environment. What this concept means?
I think healing environment is very important. The environment can make you sick, but it can also assist you in getting in good health again. And healing environment means that apart from the top class medicine, we continuously adapt the ambience of our clinic to the needs of our patients. This concerns the comfortable furnishing of the rooms, the care of our dedicated medical staff, and the excellent food supply. In a feel-good environment, our patients can recover more quickly, and all this makes the Döbling Private Hospital a place of recovery.
Professor, you have a lot of experience in treating patients not only from Austria, but also from all over Europe, I think. What do you generally see? Where do you generally see the future trends in patients' care?
I think the future lies in an individualized medicine and patient care, starting with a tailor-made prevention and program and screening program, which is based on the individual life situation as well as genetic risk factors. minimal invasive therapy will get more and more important, and which is tailored to the individual situation in each case. Gender medicine will also gain more important, since men and women have different symptoms and react differently to different therapies. And more attention will be paid to this gender-specific treatment in the future. And we are on a good way in this direction.
Thank you, Professor. Now we ask our audience to put some question for you if they are interested in some particular issue that were not covered during this discussion. So my colleagues will just send us the question from some. So the first question I see is, does the PremiQaMed group have Romanian physician or nurses? If not, are you interested in employing Romanian physician or nurses? No, Sonja or Professor Kainz?
I did not hear the questions so good. The question was
do you have in your hospital Romanian physicians or nurses? And if not, would you be interested to employ?
We have some Romanian nurses. At the moment, we do not have Romanian doctors at our hospital. But of course, we have language interpreters all the time available if someone wants to communicate it in his native or her native language.
I think you just actually answer to another question from one person. If you have, for the Romanian patients, do you have access to a translator if they don't speak English or German? But I think you just answered to this question too.
Yes, we have access.
Another question is, one of our followers is interested in your medical expertise. Please talk about one particular case, a difficult case that you solved during the last couple of years in your hospital. A difficult case to a difficult patient.
A difficult case. Yeah, we had, for example, a patient with a very big ovarian tumor, and she was told that surgery is not possible anymore because the tumor was really, really big. And we did all diagnostic procedures, radiologic procedures before, and had also a very good internal medicine treatment before, because the big tumor had already made her in a very bad general condition. And after good preparation, we were able to remove the tumor, and the good thing was that the tumor was not malignant at the end, and so she was very happy with the result.
Very interesting answer, Professor. So another, I think, is the last question. It is possible for a Romanian patient to deliver medical documents online before being admitted to one of your hospitals?
Yes, we have a special line where the data can be safely sent before they come to our hospital, and data security is a very important issue for us, and we are here in line with all the rules. But this is possible, of course, and it's also very safe with our system.
Well, this is the last, I think. Yes, my colleagues just said me there are not other questions. Thank you very much, Professor. Thank you, Sonja, for being with us at this webinar. I think all the people that watch this webinar just they are better know your clinics and what your services offer for women and not only for women. So thank you very much for being with us, and have a beautiful evening.
Thank you very much for the invitation.
Bye-bye.